Good afternoon, or good morning is still this day. Amyloidosis impacts different people in different ways, and even with the identical type of amyloidosis, you can experience different symptoms. I hope that some of what I share with you today will resonate with you as you navigate your own journey with amyloidosis. My name is Keith Dares. I live in Nova Scotia, Canada. I am a board director and secretary of our national organization, Canadian Amyloidosis Support Network, which is basically predominantly an AL-focused group. We work in conjunction with Anne-Marie's group with the TTR patients, so it's a combination of effort that we serve the amyloidosis community appropriately. I'm here to talk about how I'm living with amyloidosis. And of course, it all starts with a journey of diagnosis. In my younger years, I kept very busy. I led a very active life, combining full-time employment along with a lot of other pursuits, such as teaching photography. I had a farm for a number of years. I have a 200-year-old house, which by European standards is still new. But for where I come from, it's usually what the real estate agents call a fixer-upper. And traveling. I love to travel. I've traveled extensively in my life. However, between 2004 and 2014, I required several orthopedic surgeries. And while recuperating from those surgeries in the autumn of 2014, I started to experience some cardiac symptoms. In mid-November, after spending a week in the cardiac investigation ward, I was given a diagnosis of severe heart failure of an unknown cause. On the way out the door, I had a cardiac MRI, and 4 days later, I learned that a visiting doctor who did the MRI scan found, suspected amyloidosis. And I found out later on through dialogue with other doctors that he had amyloidosis experience from the NAC in London. So I underwent cardiac biopsy on December 22nd, and the samples proved positive for amyloid. Further analysis of diagnosis of transthyretin wild type came to me on January 6, 2015. So for those of you who have done the math here, my journey to diagnosis was less than 9 weeks. Given the disparity between the norm, 5 to 7 years, and my short 9 weeks, I'm living testament that the disease awareness makes a difference to time to diagnosis. It's critical. It is the major key. And I'm so forever thankful to that visiting doctor who shortened my journey to diagnosis by approximately 250 weeks. And that makes a significant difference in the outcomes in the future. Without this disease awareness, it is quite possible I would have died before I was diagnosed. It was that bad. Once I was diagnosed with wild-type amyloidosis, I made it my mission to become an informed patient. I sought out information, contacted specialists, learned as much as I possibly could about this disease, which was progressing every day to weaken my heart and shorten my life. I also learned that there were drug companies who were working really hard to get drugs on the market to slow the rate of amyloid deposition. And with the encouragement of my amyloidosis doctor at the NAC, sitting here in front of me, I was encouraged to look for a suitable clinical trial to get on. Well, that took me 3 years. That's 3 years of hard work looking for clinical trials while the disease is still progressing. So I finally got accepted on a clinical trial for a silencer drug, and I was also fortunate to be approved for use as a stabilizer drug as well while I was on the trial. So I've been on dual therapy for approximately 6 years, and I've recently found out that in the clinical trial, I was on the drug arm of the trial, so I've had dual therapy for 6 years, and it's working extremely well for me. I've seen a gradual improvement over this time in my health and quality of life, and it's made a big difference, not only in my quality of life, but my longevity and my outlook forward. But living with a chronic condition and being on therapy has meant altering my ways of life in many areas. Spontaneous activities are mostly a thing of the past. I can no longer just pick up and go. More planning is required for basically everything: appointments, shopping, attending and social gatherings, events, traveling, basically everything. I plan activities to accommodate my limitations in energy and physical abilities. Daily diuretics manage the fluid retention caused by my compromised heart. Without my water pill, the fluid buildup would negatively impact my health and put additional burden on my heart. I've learned by trial and error, and sometimes embarrassment, that I need a toilet access for a span of 3 to 4 consecutive hours each day. So that really limits what you can get done. I have some flexibility with that timing. However, there's no option for me to skip a dose. I'm retired, so that helps. So on days when I will be away from home, I can rise a little earlier to take my medication, or I can delay the dose by a few hours to accommodate appointments. It's not a difficult thing to manage, but it does complicate life. Doing anything at all takes energy, and I'm still learning as I need to recognize my thresholds and be smart enough to back off before I cross over that line into fatigue. It takes me several days to recover. Due to the damage amyloid has caused to my heart, my physical abilities and endurance are limited, and I need to manage activities to avoid fatigue. I must remember, or more appropriately be reminded, that I do not perform as I once used to, and that things that I did once with ease are now difficult or even impossible. It can be very frustrating for me. Some disabilities like cardiomyopathy are invisible. I don't look sick. But how many times have I received that look when I park in a blue badge area? But I'm limited physically and always need to be mindful that while I can do most everything I want to do, I have to pace myself and set reasonable expectations. So instead of completing a task at one go, I take breaks. Even a 20-minute recovery break can allow me to keep going again without major fatigue setting in. I try to plan my tasks to be energy friendly. Still working with that. Basically, I try to organize tasks so I reduce energy output. I modify tasks and use tools to lighten the exertion. Where I previously carried things, I use a wheelbarrow to move items around the yard. I now use a vehicle. Instead of several trips to the curb on waste collection day, I combine everything and try to make it in one trip. And this is a big change for me. I have to ask for help, something I'm not used to. I have found that there's no shame in asking and for receiving assistance, but I got to learn to put pride aside. Traveling has been a long life passion of mine. As any patients on diuretics and ATTR medications, you know about dry mouth. Although I intend to continue and travel for as long as I can, but I have to modify the way I travel. I have traveled independently most of my life. I've been to 72 countries, and most of that independently. And now I rarely travel without my partner and my caregiver. It is reassuring to have her by my side, knowing that should I become unwell, she'll help me navigate through foreign healthcare systems, make decisions, and lend support. When I travel for an event like coming here, I am mindful of the extra energy it takes. I build in extra time to charge up in advance, and I always book time for after the event to make sure that I get energy back to carry on my travels. I don't move very quickly, so running to catch an aircraft is not in the picture. I recognize that my healthcare team is an invaluable partner on my journey with amyloidosis. I help them to help me by documenting changes to my symptoms and overall health and relay this information to them. I keep a personal medical journal and document my vital signs daily along with notable events, and I take that to me with every appointment. This journal gives precise dates, time, and nature of changes and notable events since my last visit. If you're not already keeping a journal or recording these kinds of notes, I would encourage you to consider it. It may take you a little time to develop a habit, but in my experience, recording this information will inform your physicians of what is happening between visits so that they can be more aware of how you are doing day to day, and which may reveal a need for a change to medication or treatment. Ultimately, remember, you are the best expert on you. And the more information you share with your healthcare team, the more they also become an expert on you. I'm learning to access support when I need it. If amyloidosis is causing hardships to you, seek assistance from external sources. Tap into friends, family, social service organizations for assistance with things like yard work, home maintenance, transportation, grocery shopping. Being independent takes on a different meaning when you're living with a chronic illness, and denying yourself help won't benefit your physical or mental health. We need to accept that some activities or tasks are no longer within our capabilities, but assistance is available. To close, I'd like to share with you what living with amyloidosis has taught me. Amyloidosis does not define me. I do what I want to do, albeit I do it differently. The changes I've made since my diagnosis did not happen overnight, but I have learned to be creative with planning, timing, and modifications, use of tools, or altering the duration of activities to accomplish the things I want to do. Today I am functioning at a much higher level than I was at the time of diagnosis, and I have hope for what the future will bring. While benefiting from therapies as a slow progression of the disease, I'm also looking forward to new therapies that may even reverse some damages and perhaps push me closer to normal functionality. Thanks to good health care, therapies, I'm alive and living with amyloidosis, and that's far better outcome at year 10 than the projected 5-year expiry date I was given in 2015. I'm here for the remainder of the day, so I'd be happy to entertain any conversations that you may have or questions. But most importantly, I'd like to thank Rosaline and her amazing team for putting this fantastic conference together and inviting us to be here. It's absolutely truly wonderful what you're doing.